This video has been created to demonstrate how to complete a baby bath. The first bath for a well baby will vary within health authorities. Therefore, it is important to be familiar with the hospital unit policies. It is also important to consider if the baby is able to regulate their temperature to prevent hypothermia. Before you begin bathing the baby, ensure it is safe to do so. Some factors to consider when making this decision is, has the newborn demonstrated consistent, stable temperature readings? And are there any other health risk factors that would compromise the well-being of the newborn, such as unstable blood sugars? Once you have determined it is safe to complete the newborn bath, ensure the room is warm to provide and promote thermal regulation. Next, gather all the supplies you will need, such as warm towels, face cloths, hat, clothes, diaper, baby soap, gloves, and a bathtub. It is important to prepare the bathing and dressing station before you start. Please remember never to leave the newborn unattended during the entirety of the bath. Don't forget to complete hand hygiene. Cold water tap on first. Add hot water to adjust temperature. Test the temperature of the water with the inside of your wrist. If the water is too hot for you, it will be too hot for the baby. It is important to remember that the newborn should never be placed under the running water, as the temperature of the water can fluctuate. Therefore, fill the bathtub with the water first. Don your clean gloves. Undress the baby, leaving only the diaper on, and wrap the baby in a towel with the head exposed. Pick the baby up while supporting baby's head with one hand and placing the remainder of the body under your arm on the same side of your body. Hold the baby over the bathtub. It is important to remember to bathe the baby with the principles of washing the cleanest areas to dirtiest areas. Therefore, start by cleaning the baby's eyes with the face cloth, from the inner eye to the outer eye. Rinse the washcloth and repeat on the other eye. Clean the remainder of the face with the washcloth. Ensure to wipe under the ears and chin. Wash the ears with a moistened corner of the washcloth, and remember, try not to get the water into the baby's ears. Once you have washed the baby's face, you can now proceed to wash the hair. Wet the baby's hair with the washcloth or your hand. Then apply baby soap. Gently lather the soap on the baby's head by rubbing your hands together in a circular motion. Once the hair is washed, now place the baby on the drying station and dry the hair with a towel to prevent heat loss. You can now place a hat on the baby's head. Now proceed to wash the remainder of the baby, unwrap the baby, remove the towel and diaper. Simply hold the baby by placing your forearm across the baby's neck and placing your hand under the armpit around the shoulder. Your baby is well supported and can now be placed into the bath. Ensure to keep the baby's head above the water. The baby may initially cry when placed into the water, but once they feel the nice warm water, they will become more relaxed. Gently wash the baby's body with the washcloth. Ensure to wash under the neck, around the umbilical cord, in the creases, under the arms, fingers, toes, genital area, and buttocks. This is also a great opportunity to complete a newborn assessment. Inspect the skin and the umbilical cord area to ensure it is free of infection. Ensure there is no redness, no swelling, and no discharge. To wash the back and bottom, you will need to turn the baby onto their tummy. To do this, hold the baby same arm with your other free hand and transfer the baby from one wrist to the other, ensuring to keep the baby's head above water. The baby can stay in the bath as long as you both are comfortable and the water remains warm. When ready, place the baby on the drying station, ensuring to use a towel to dry the baby. Ensure to dry under the chin, armpits, creases, and around the umbilical cord. Once the baby is dry, you can now dress the baby. This is a great time to suggest skin-to-skin contact with the baby and the primary caregiver. Once finished, clean the area, complete hand hygiene, and document the bath.